Oh, I just have a question. So I work in a palliative care clinic very closely with nurses. It's a shared care model. And I think that nurses are probably, like the doctors kind of have a choice if they want to play ball or not with medical marijuana, whereas if you're not a nurse practitioner, you're very much front line. And I don't know if it's, but I think the nurses get very much the brunt of patient questions. Maybe it's an intimidation factor that a lot of patients are afraid of bias and stigma from the physician, and more likely to talk to the nurses about it. So they get a lot of questions. They also get questions about how to use it, how all the harm reduction stuff, and then all of the burden of dispensing in the hospital and what to do with the medication, how to safely manage it, and coming up with all of those guidelines. So I think that they're doing the lion's share, honestly, of the heavy lifting with this. So I guess one thing that I was wondering is, what are the nursing resources then for trying to learn more about this, and also for standards for institutions in terms of how have other people done it? How did the nurses manage to protect themselves, to make sure it's safe, so that not everyone's trying to recreate the wheel?
Thank you for your question. We're developing resources that are applicable to the jurisdictions, but there are just jurisdictional specific resources, especially around your question for hospital and policies. Some jurisdictions are developing specific procedures and guidelines for how to keep the products, like all these policies. And we're going to develop more, and we've also tried to develop online tools that are accessible to nurses wherever they're working. So if you have any ideas, anything that stigma and bias is an area that we have learned through the survey, that's a new area, and I agree with you. There's a lot of questions that the nurses need to get information on, and they're looking for education. And as you can see, there's a higher number of nurses in this meeting because of the need to get more knowledgeable around this issue.
Do you have the references I said were not for medical? Like one was for, one was non-medical?
Yes, we have those, yeah.
You
I have a copy.
For medical also, though, for medical?
Yes.
Okay.
Yes, we do.
Okay, thank you.
We're starting. It's not a complete set, but we're starting to develop more and more. That's a very good point because of the need.
Okay, thank you.